Apart from that, there could be other causes of failure, like missing a multiligamentous injury. So sometimes the ACL that's written on your MRI report may be just the tip of the iceberg. There could be coexisting collateral ligaments injuries like the MCL, the LCL, and sometimes even the PCL. Because when the PCL breaks, you may have a pseudo-laxity. So it may appear like the ACL is torn, you may reconstruct the ACL, but the patient may still be symptomatic because actually it was a PCL tear. So proper diagnosis, missing a proper diagnosis. Collateral injuries like your MCL and LCL also many times are not identified at the time of the index surgery. It could be because there was a lot of swelling, it could be because of a technical problem in examining the patient. Now, when that happens, there is a possibility of persistent instability even after doing an ACL reconstruction. Identifying this is important, and sorting out this problem at that stage is very important by doing a collateral ligament reconstruction. If the stresses on the ACL were not bad enough to make it fail, if the ACL is also failed along with it, then you would have to do a revision ACL reconstruction with collateral ligament reconstruction. The other factor is rotatory instability. So what is rotatory instability? So you should think about the time when you were a child, when you played with certain discs which were stacked one on top of each other on a stick. So you would do this, you would stack them one on top of each other with a stick in between because they had a little hole in the middle. Now if you remember these discs, you couldn't push them front to back, but you could rotate them. So this is rotatory instability. Now many times tissues over the medial and posteromedial side especially get stretched during an ACL injury, and as a consequence there's something called a ramp tear that may happen. Now what is a ramp tear? A ramp tear is a meniscocapsular separation of the medial meniscus from its capsule. Now this has been identified as a very important cause of failure of ACL reconstructions. Identifying this, repairing the ramp along with the ACL reconstruction is very important. If it has not been identified at the index surgery, when the ACL is failed, remember to repair the ramp and then do your ACL reconstruction, because if the ramp is not repaired, stresses on the graft will be very high and they can again fail in a period of time if not done concomitantly.